Well, hello, everybody, and welcome to this week's The Beautiful Bag podcast with my special guest, Sam, the Aussie Ostomate. We met on Instagram, and I say this every single week. I'm meeting all these Ostomates on Instagram, and I love how it's building a huge community around what's going on with people with ostomies. And I know Sam has an amazing story that she's going to share with us, and just how life is like. So, Sam, welcome today.
Hello, thanks for having me.
So excited you're here. So excited you're here. So let's talk about it. What's the story? Everybody's got a story. So what's the story?
Yeah, well, for me, years ago, like I always had a bit of a dodgy gut, but never thought much of it. Would just avoid certain foods and, generally felt okay and had pretty good overall health. And then when I was pregnant with my first child, I had some bleeding from my rectum. Um, and, that was a bit worrying. And the doctors just said, oh, it's okay. It'll just be hemorrhoids. You're pregnant. These things happen. Months went by, I had a bit more bleeding, but it wasn't too bad. But I started getting some, it's going to get a bit too much information, but everyone with an ostoma's sort of used to these chats. And I started having urgency, having trouble holding on to get to the toilet in time, basically, while I was pregnant, and extra mucus. And that was, getting a bit difficult. But again, it was, oh, well, I'm pregnant. These things happen, and just kind of brushed it off. And once I had my daughter, sort of another month or two of symptoms and feeling just generally unwell. And I had a colonoscopy which diagnosed ulcerative colitis. So that's a type of IBD, inflammatory bowel disease, for those
Mm-hmm.
who don't know. So they put me on steroids, which is a common treatment, and they've got some lovely side effects in themselves. And
Mm-hmm.
felt pretty average, but I was a young mum and, running on minimal sleep and just kind of kept cruising along like that. And my ulcerative colitis probably wasn't under, that well controlled really. And then I became pregnant again. And during that pregnancy, I mean, some people with IBD say when they're some women, sorry, with IBD, if they're pregnant, they either get a lot better or much worse. And for me, pregnancy didn't agree with my gut, and I started having more proper accidents and not making it to the toilet. And you just kind of get used to that. Like I'm a nurse, and ironically enough, I've always looked after patients with ostomies. I've spent most of my career doing that on a surgical ward, and most of our patients have colorectal bowel surgery. And I never in a million years thought that that would be me. And even when I was diagnosed, I guess I was probably a little bit in denial of that about the seriousness of my illness. And my sister had ulcerative colitis, so I saw her managing it quite well. She just took some medication, and she was lucky that that worked okay for her. She had a couple of bad days, but generally she was okay. So I'm like, well, I'll just do that, and you just sort of get on. And but my symptoms got worse. We tried some other meds, had my other daughter, just kind of a steady decline really. And
Mm-hmm.
you get used to that. Just became my new normal. Going out to the shops, worried where the nearest toilet was. You have this internal radar, where where all the toilets, all the toilets around the place, even from my home to work at the hospital 40 minutes away, I knew all the toilet stops on the way. And sometimes I didn't make it. Like it was just horrible. And it's not just the accidents. I mean, that was a big part of the anxiety for me, I think. But also just feeling so unwell. I say to people, it's kind of like food poisoning 24/7. You're going to the toilet so much, you've got a decreased appetite, you're nauseous. It affects everyone differently, but for me, I was just so run down and just so fatigued all the time, and so weak, and it was really hard just to do day-to-day things. Yeah.
Oh, yeah, it sounds like it. I mean, I talk to a lot of people lately because of this podcast who, it's Crohn's and it's colitis, and they all talk about the pain that you live
Mm.
in and the accidents. And, I just talked to the girl last week. She was she had to wear a diaper and she was young. I mean, she was 9 years old when
Yeah.
they found her Crohn's, so,
Mm.
and she decided to get put in an ostomy right before she was getting married. She's like, I don't want to do
Yeah.
this anymore. I want to enjoy my wedding. And so, to have you like pregnant and having to deal with all of this on top of pregnancy, I mean, that's a
Mm.
lot. That's a lot that you went through. So now what happened that made you, when did you get to the point where you're like, you know what, that's it. I'm getting an ostomy. Was it your decision to say, that's it, I'm done? Or how did that
Yeah,
come
it was
about?
it was a bit of a gradual process for me. Like, luckily, I had lots of time to process it, and as a nurse, I had a lot of insight, which helped. Um, so at first, the symptoms got worse and worse. Like I said, tried lots of. You sort of go through a checklist of medications to try
Hmm.
up until the intravenous biologic meds that can be quite horrible as well. And so we tried all those, and the doctors just keep trying. The stoma or ostomies, the last resort. They always say, "Oh, let's try this other drug, try this other drug," and it got
Right.
to the point where there weren't any other drugs to try. But it was a stoma nurse, the stoma nurse at my work, and she'd been a colleague for years, and she was the first one to really plant the seed of the stoma being not a last resort, but an option for me. And then once she sort of had a chat to me about that, and I started actually going online and social media and seeing other people, because most of the patients I'd had were elderly, having stomas. So I couldn't really put myself in that position having one at my age. I was in my early 30s then, and so, but seeing other people online, and I connected with a girl in Melbourne, and she was lovely. I think I found her on a Crohn's and Colitis website, and we got chatting, and that really helped. I think just to see how good it could be, like the positives of getting a stoma. And
Right.
once I got my head around that and was like, yeah, no, I'm sick of feeling like this. And I remember the day going to see my specialist, my gastroenterologist, um, and I'm like, that's it. Today's the day. I'm going to tell them, give me a stoma. I've had enough. I don't want to try any more drugs. But they pretty much said to me, your bloods are really bad. Like, my inflammatory markers were terrible. They're like, we need to operate, as soon as we can. And luckily, I'd already met up with the surgeon, and we'd had those discussions, and so he knew me, and it was good that it was probably happened over 3 or 4 months, that process. I'd been in hospital unwell, and um, yeah, it was still hard to wrap my head around, but I was accepting the fact that at least this is going to hopefully get better. And it did. It did. I had my surgery in 2017.
Okay.
And pretty much straight away, like, I mean, you feel unwell, as you know, after the anesthetic and everything. But once I got out of that first couple of days of feeling a bit sick and that from the medication and all the pain drugs and that, it was like I was free from that constant, like, colitis pain, those crampy sort of pains. I really felt that pain lift, and I felt free. So the stoma, I could put up with that. There was, that was still a bit daunting. Like, I still remember that. I think most of us do, or depending how well they are, that first bag change. I
Ah,
really remember that. It was very
ah,
vivid, and just how huge my stoma was. It was so swollen, which is a normal thing, but
right.
it makes it a bit harder to to handle. Yeah,
Yeah,
but
it definitely does. It definitely does. You're like, what is that thing I got? You're looking at it, you're like, it's this big, and it doesn't
they're
last
not
that
very
long.
pretty at first,
No.
and exactly, like 6 to 8 weeks, and they shrink down. But yeah, so that was pretty daunting, and it was so weird seeing it on me, like, because I'm so used to seeing other patients with stomas, helping them with their first bag
Hmm.
changes, and supporting them. This is how you empty. This is what you do, and now this is me. So it's very surreal, and trying to get used to that. But again, I felt better, so I was managing it. And initially, because the diagnosis was ulcerative colitis, which affects your colon, the plan was to have my colon removed in that first step. I was so unwell, we were going to take it slowly to form a J pouch,
Hmm.
which is an internal pouch created out of the small intestine. However, once they removed my colon, that first surgery, they realised I actually had Crohn's disease. And this happens sometimes. It can be a bit of a grey area, or indeterminate colitis. or Crohn's colitis. So Crohn's with my colon, basically.
Mm-hmm.
Because Crohn's could appear anywhere from your mouth to your anus, anywhere in the gastrointestinal tract. There was a risk that even if I had the J pouch formed, the Crohn's could come back, and I didn't want to take that chance.
Right.
At that point, my kids were nearly 1 and 3, so they were really young, and I didn't want to go through more surgery. I was feeling well, so I'm like, well, I'll just stick with the bag, at least for then, and I still have, and I've still got my rectum, a rectal stump, but it's got some active Crohn's there, which doesn't bother me too much because it's not in use. The stool's diverting through my stoma, but no, I've generally, it's been pretty positive since my surgery. Yeah.
I love it. So now you've been living with it for 4 years now, 3 to 4 years, right? So 4 years. And, how has life been? I mean, you said you're free of pain, but what have you been able to do these last 4 years that you haven't been able to do prior to that?
Yeah, it was probably the main, like even just the simple things in life, just going to the park with the kids, not worried that I'd have to run away, go to the toilet and grab the kids and run. Like I really appreciate those simple things at first, just being at the shops, I could turn off that toilet radar. Mm-hmm. It was great. I'd have a spare stoma bag in my handbag just in case, but I was able to finally relax a bit, which takes time though. I think I had such anxiety there, and I probably still have a bit of that. It's once you go through, it's hard to really let that go, but yeah, so much better. And even back to work. And I think as a nurse, like it changed me as a nurse. I hope it made me a better nurse. I think more empathetic to really understand what patients are going through, because I've been on the other side, like I've been a patient now and been through that surgery, and I think it's made me a better nurse, and just more understanding with what they're going through, their families going through, because I saw my husband and my family watch me be unwell and how scary that can be. And yeah, no, and it doesn't stop you. I still swim and go to the beach, and I haven't jumped out of a plane or anything crazy like that, but I could if I wanted
to. Yet you just may. Isn't that a wonderful, like you said, you said it in the beginning of the interview, you said it in the beginning, was you felt free, no more pain, like the pain is gone. I can do what I've always done. No more worry. Right. So on the other side of it, you're probably like, this was the best decision I could have made for myself.
Yes, and if anything, I could have even done it earlier, but hindsight's a great thing. But even my specialist now says to me, wow, like I don't think we realised how unwell you were till we removed your colon and saw how damaged it was, it perforated. And my grandmother, this is many years ago, she died from IBD. Her bowel did perforate, but that was back in the 1950s. So stoma surgery was only really kind of starting out. It would have been pretty scary to go through. But I thought of her a lot when I went through that whole process, and being unwell and how fortunate I was that I had this second chance at life and she didn't. So, and my mum was only 3 at the time and her sister 1. So I could really put myself in her shoes. She had young kids she had to leave behind. So
right.
Yeah, it really is a lifesaver, a stoma, and yeah.
Oh, I love it. I love your story, and I love the beauty behind it, right? And I think that's one of the reasons why I called this the beautiful bag. It's because it is beautiful, because you do get a beautiful life. You get something else on the other side of it. And it doesn't have to be all what we think. I mean, yes, it's a bag that collects poop, but so what? You know what I mean? Yeah, it's not like we really walk around in it all day long. I mean, you go to the bathroom, you empty it. It's not like it's the same kind of routine-ish, Yeah.
Yeah, and we all poo. That's what I like to say to people, it's no different. And if anything, like I like to say to patients, our wind, our farts are filtered. So
seriously,
we probably smell better than the average person. We go to the bathroom for business, and we walk around with no wind. So
no wind, and you can put like drops inside the bag too, right? Yeah. So even it smells like roses. We can actually make it smell like roses if you want us to. So now how is your husband with everything? I mean, you said,
Yeah, no, I was lucky that he was so accepting of it. And, you know, like I said, originally the plan was for a temporary stoma, but that changed. And he was like, whatever you want to do, you know, we've been together for, many years now. We've been married for 10 years this year, together for like 18 or more years. But it was so, I think he'd seen me so sick, and to see me better, I think he could, you know, I've never really asked him, but he's always just so supportive and never questions anything. And I don't know, it doesn't even, yeah. I mean, it's not like he watches me change my bag or anything, you know. I'll still close the bathroom door while I do those things. You know, he doesn't need to see that, but just so supportive. And he was the one that encouraged me to become a stoma nurse. So after probably the year after my surgery, I did the postgraduate in stomal therapy. And so now I work at the hospital that I had my surgery, and I've been working for years as a stoma nurse, and just part-time. So I still work on the ward as well, that I've always been on, looking after patients. So I get to see them in both roles and help them through. And that's been the best part of it too. I think, you know, it's such a feel good thing I'll tell them about it. Like if I see someone even before their surgery and pre-op and pre-admissions and that, and explain to them about the stoma, and I can see how nervous they are and everything they're going through. And like, because I was there, I remember that feeling and getting sighted, you know, getting the mark on your belly for where your stoma is going to go. It's also so scary. But then I often do, like at first I thought, I probably won't tell anyone that I've got a stoma, but I tell everyone, like I'm an open book. But I find it just straight away, it just reassures them, and they just relax. And then all these other questions come out, and you know, do you swim? Can you shower with it? And just more lifestyle questions. And that was the thing as a nurse, before I went through this, it was all about the clinical hospital setting. I never thought about what happens once the patient leaves the hospital and they go home, and you know, they might have this for the rest of their lives. How does that work? And now I know, and I can give that information to patients and reassure them. I think that's the main thing. They see me there in my uniform. They can't see my stoma. They know it's easy for me to disguise. A couple will say, can I see it?
yeah.
And I don't mind. That's okay. You know, I'll just sort of flash a little bit of my bag, but you know, the bag doesn't get out much, but that's okay. Whatever I could do to help people and make them feel better. And that's been wonderful. Yeah.
I love that. So now you said you get lots of questions like, can you swim? And you're like, I swim, I do everything, you know, can you work out? Like, what kind of questions do they ask? Like, what things are you doing more now than you did
So I
prior?
think and I think because you value your life a bit more, and like I said, enjoying the little things in life, going through an experience like that, as you'd know, coming out on the other side of those experiences, you do want to try things, and you won't sort of hesitate as much. And I'll have a go. It's like the stoma nursing course. You know, I never thought about doing any more study, but I was like, let's do it. Like, let's take it on. And I've been trying. I'm keen to do a marathon finally this year. With COVID, it upset things last year, but to raise money for bowel cancer Australia, because so many of my patients unfortunately deal with bowel cancer, and I thought it would be wonderful to tell my patients, I just did it's just a half marathon, but still, you know.
Hey, 13.2 is a long time. That's yeah.
Like, you know, I've seen other ostomates on there, and that's the beauty of social media. Like, I've seen so many out there with a stoma doing these marathons, and it's just so inspiring. And so I'm in training, so watch this space.
Yay! So now you're running marathons. You don't have to worry about where the toilet is along the road. You can just.
That's it. Like the first Sydney to Surf I did, that's in Bondi in Sydney, and it's a 14K sort of walk or run or whatever you want to do. And I just walked it the first time. It was only a few months after my surgery, and I'm walking it, and I'm looking at the lineup, the queues for the portaloos, the outside toilets, and I'm thinking, I don't need that. Like, it was just great. Like, I would have never have done that with my illness, and now I did it. I went the whole 14Ks without needing a toilet stop. It was fantastic.
See, I love
That's
that.
great.
I love that. So if
Mm.
you were to, I've thank you so much for being so open and talking about everything. It has been a wonderful getting to know you and getting to know your story. If you were to leave the audience, leave the listeners with one tip, what would that be?
I think just being kinder to each other. I think with an illness like IBD, it's an invisible illness, and we don't know what it, it makes you realize you don't know what's going on with someone's life and what they're going through. And I think if we could all just be a bit kinder to each other and, even just to strangers, and yeah, just value every moment and enjoy your life. And we're only here once. So yeah, it's all good.
It's all good. I love it. I love it. Well, Sam, thank you so much for joining us today. And listeners, if you want to find the Aussie Ostomate, just go onto Instagram, and that's how you can find her. Aussie Ostomate on Instagram. I'm sure she would answer any questions. If you guys messaged her, she would answer any questions that you would have that maybe we didn't answer here on the podcast. But go and connect with her for sure. And again, if you're looking for Ostomates, if you're looking for stories, you can listen here on the podcast, but you can also go, like I said, Instagram seems to be the platform that most people are showing up in. And just use hashtag ostomy and you'll find a whole bunch of people posting their pictures. It's not just, like Sam said earlier, it's not just for the older people that she had taken care of. There's a whole lot of young people with it too. So thank you again, Sam, for joining us.
Thank you.